to tempt yeah, Magami, Mam Scutamahu, Axon, Mijeta, Sino Gama, Gama, Today we wanted to talk a little bit about the illness, this coronavirus. We learn more about this virus every day, and what we learn every day causes us more concern. We know that it's a very infectious disease in the sense that it will infect a lot of people very, very quickly, and that it puts the seniors with pre-existing conditions in harm's way. But it's not only the seniors. Young people are also being affected. 35 to 44 are the most the people that are really affected seriously. And the thing with young people is that they can get seriously ill. They recover in a lot of cases, but they can stay sick for a long time. And what we learn about this virus is that by the time you're seriously ill, it's been 10 to 14 days. And you may have gotten sick 5 to 7 days prior to that. But during all that time you were a carrier and infecting people. So we may not even know who has it. But what we need to do is listen to our healthcare providers in terms of the instructions in how to prevent spreading this disease. Because we all care about our parents, our grandparents, our kids, and this is all about protecting ourselves and our family members and our neighbors. So we know that this disease is very infectious and can very quickly overwhelm our small health center. And we need to protect our health centers, and the way to protect them is to follow their advice. Currently there's no cases in Saddle Lake, and we want to keep it that way. But in case we do have some cases, we are currently ramping up our ability to safely care for a large number of people. And that'll include things like shelters, homeless shelters, isolating units, isolating people, a place to isolate people, getting the funds to make all of that happen. And we're talking regularly with the government to make sure that money arrives in time and in an orderly manner. And so the burden that we have is huge, but we have really good people and people who are committed in terms of protecting our community and making these things happen. So with that, I'll turn it over to Dr. Cardinal.
Thank you, Chief Shirt. My name is Dr. Nicole Cardinal. I'm one of the family physicians that's working at the Saddle Lake Health Center. We would like to reassure the community that we will continue to have the medical clinic open as long as we're able to work. Our goal is to provide access to COVID-19 testing so that we can identify any cases that develop within our community. We are currently testing the following symptoms: fever of greater than 38 degrees Celsius and or new onset or exacerbation of cough, influenza-like illness, respiratory symptoms which include cough, shortness of breath, and sore throat, and who meet the COVID-19 exposure criteria, which is in the 14 days before onset of illness, a person who has traveled to an infected area or has come into close contact with a confirmed or probable case of COVID-19. If you have any questions, please direct them to the medical desk so that a physician can assess you and testing can be arranged. I would like to remind everyone that we are entering a dangerous 2-week period. We know that there is community transmission, which this means is that you're at higher risk of becoming infected outside of your home. When you participate in activities such as shopping or going to the store, you touch many objects that are not disinfected. For instance, door handles, grocery carts, and even money. We do know that the virus can live on a surface for 3 hours. This is why hand washing is so important to do when you leave your home and when you return home. I would also suggest washing and disinfecting commonly touched surfaces in your home as well. I also wanted to discuss the importance of social isolation. This means staying home and only leaving for essential services for instance, going for groceries. Social isolation means no visitors in your home and you not leaving to go visit other people. It also means keeping a safe distance from others when you are outside of your home. I understand how difficult this is for our community. We rely on social interaction, family and community support during difficult times, and it is hard for people to follow social isolation rules. I remind you why we are doing this. Our hopes are that we are able to slow the spread of the virus by staying home. We also hope to have less infected people in our community if we stay home. It is also the only way that we can protect our elders from becoming infected or having severe complications due to the virus. If you have health conditions such as diabetes, lung issues, asthma, kidney, or heart problems, please take extra precautions to protect yourself. We do know that if you have underlying health issues, this infection can be severe in these patients. I urge our community to stay home and to protect your families. To date, like Chief Shirt said, we don't have any cases in Saddle Lake. This does not mean that we are safe from the virus, COVID-19. It just means that we need to keep testing our community members and to continue to be vigilant of this virus. We all need to do our part in order to keep our community safe, and I hope you can continue to follow the instructions by Chief and Council. Stay home when you are sick. Wash your hands frequently. If you have symptoms, please call the health center. And again, please stay home. Thank you.
Dansa Evelyn Johnston Zikasun. I work with the Saddle Lake Healthcare Center. I'm the director. First of all, I just wanted to say that this is a trying time for us all. And I know that many people are panicking, but I'd like to assure you that our band is doing the best that it can to cope with this current crisis. To date, you've heard Dr. Cardinal and Chief Shirt confirm that there are no cases of COVID-19, and we'd like to keep it that way. Since things are changing rapidly each day, we'll do our best to try to ensure that you're getting the latest information. Natalie Wood and Jody Ann Half have been hired to do this, and I'd like to say they're doing an exceptional job. Some things to remember, I guess, is to keep calm, and I know that's easier said than done, but just by limiting your TV watching, social media, we need to talk to one another, call into a mental wellness line if need be, and again, maintaining the social distancing, at least 6 feet from one another, no shaking hands, hugging, and also encouraging you all to stay home and not to travel if you don't have to. This is particularly important to those who are over the age of 65 and those with the chronic health conditions that Dr. Cardinal mentioned. We ask families to keep our elders safe by not visiting them, and I know this is going to be very, very difficult. You could do this by providing food and care packages to them, maybe running errands for them if you can, and definitely not coming to work if you're sick. You must self-isolate now for at least 10 days. This is one of the changes that's been made. The Saddle Lake Healthcare Center is working closely with all other departments in ensuring that we are meeting the needs of our people. We are part of a smaller task force which was appointed by Council to address the following and will be meeting daily. Our number one priority is that we are working with Norma Large on an emergency pandemic plan which will outline our priorities and needs along with a budget. This will be submitted by this Thursday's deadline. Looking at food distribution to those who are self-isolating or in quarantine to start off. Obtaining personal protective equipment which has been in short supply for our healthcare workers and other personnel. Establishing an emergency call-in center for those with questions who need assistance, food delivery if they are in self-isolation or quarantine. We'll also be hiring an emergency management coordinator. So you need to contact Perry Large at the Tribal Administration if you are interested in this position. The Saddle Lake Healthcare Center is also implementing the following protocols and procedures. Dr. Cardinal and Dr. Soko and staff are doing a great job despite limited supplies, testing, etc. And this has been very frustrating, but thankfully we are now getting some supplies in. Only 10 people are allowed in the waiting room of the health center, and all need to be screened upon arrival. Your temperature is taken, and our staff will ask you a series of questions. You will then be asked to wash your hands. If you are having symptoms, you need to self-isolate immediately for 10 days. If you're having difficulty, as a lot of people are in getting through to 811, contact our medical desk immediately, and our physicians will determine whether or not you need to be tested. All of our healthcare workers will be tested if they come down with symptoms, as they are the frontline workers. Please be patient, as some of our non-essential programs are closed and some staff are working at home or coming in on a rotating basis to ensure access and the continuity of essential services such as medical transportation, home care. Again, there may be changes as required. All community events and gatherings and some of our regular programming has been postponed until further notice. In conclusion, we are depending on everyone to take this situation very seriously. Let's do all that we can to keep our families and our community healthy and safe. Bye.